Thanks, Emma. Welcome, everyone, and it's nice to see so many people coming tonight. So people often ask me why I decided to focus my practice on pelvic health. And the reason is that there's a lot of people out there suffering silently from pelvic health symptoms. The symptoms can hugely affect people's quality of life, both physically and mentally. And when people do receive physiotherapy for their symptoms, it can be hugely life-changing. So it's really rewarding work. So I'm going to share with you a tale about a patient I saw, Brandy, and she's a good example of how therapy has changed her life. So, maybe.
Just the right arrow?
Yep. Brandy's coming. She's just a little late. There we go. Thank you. So this is Brandy. She is a third-year law student, and she came to me about a year ago for therapy. Brandy was having lower abdominal pain, which was there constantly. She had pain around her tailbone that was there when she sat for longer than 5 minutes. She had to go to the bathroom at least every hour. And if she left it for too long to go to the bathroom, she would leak before she got there. So the symptoms had been going on for about 9 months, but she'd been too embarrassed to tell anyone about her symptoms. What finally brought her into physiotherapy was that she started to have pain with sex. So she told me that she was stressed with her workload at university and her workload was affecting her relationship. To relieve stress, she went and she did intense workouts at the gym, but her pain was actually worse after the workouts. So we'll come back to Brandy soon, but she's not alone in people suffering from pelvic health symptoms. So incontinence, which is a leakage of either pee or poop, is a common problem for 1.1 million New Zealanders. That's the population of the South Island. That's a lot of people. Pelvic organ prolapse, which is a dropping of the bladder, the uterus, or the rectum down into the vagina, can affect up to 50% of women who have given birth, and up to 25% of people worldwide suffer from pelvic pain. So many people believe that these types of symptoms are just normal after things like aging, after having a baby, after cancer treatments. But the news is that while the symptoms may be common, they're not normal, and they're often a sign that the pelvic floor muscles have become overwhelmed and they can't keep up with the demand on them. So what are the pelvic floor muscles? So pelvic floor muscles are a sling of muscles that go from the pubic bone in the front to the tailbone at the back. That's in men, and same thing in women there. So looking, I'm not sure how much you'll be able to see this, but this is a model of the pelvis. You've got an outer layer of muscles, the superficial muscles there, and those pelvic floor muscles go around the openings to the urethra, the vagina, and the rectum. And then if you look deeper inside, that's the deeper layer of pelvic floor muscles, and they're more involved in support of the pelvis. So there's a constant level of activity in the pelvic floor muscles, and that helps them to be able to support the organs that are above them, so the bladder and the bowel and the rectum and through there, and also helps them to be able to stabilize the back and the pelvis, and they help to stop you from leaking by having that constant level of activity. So during some activities, the pelvic floor has to shorten and contract. So that's like when you lift to support your spine, when you cough or sneeze to keep you dry, and during sex, the pelvic floor muscles contract repeatedly during orgasm. So with other activities, the pelvic floor muscles have to be able to lengthen and open. So like going to the toilet, having a pelvic exam, having sex, or for delivery of a baby. So the pelvic floor muscles also work together in coordination with the other muscles of the abdominal canister. So up the top, you've got the diaphragm. At the back, you've got the deep back muscles, the multifidi. You've got the pelvic floor muscles on the bottom, and then you've got the deep abdominal muscles, the transverse abdominis muscles in the front. Okay, so we've said that the muscles, they're commonly referred to as the abdominal canister muscles, and they create a stability system that helps the pelvic floor muscles to perform to their best ability. So looking at the pelvic floor muscles, they're often described like a hammock that go from the front to the back of the pelvic floor. It looks like a hammock at the bottom of the pelvis. So generally there's two types of problems with the pelvic floor muscles. Okay? The first is what we call the droopy pelvic floor hammock. Okay? This is related to the weakness of the muscles, and that's the most common dysfunction that we know of with the pelvic floor muscles. It tends to happen with aging, after childbirth, or after pelvic surgeries. So symptoms happen because these muscles aren't strong enough to support the organs that are above them or to support the spine, or keep the openings of the bladder or the rectum closed. So these symptoms tend to include leakage of pee or poop, back or pelvic pain, dropping of the pelvic organs, problems with orgasm during sex, and for men, even the ability to get or maintain an erection. Treatment for this group focuses mostly on strengthening and coordination of the muscles. Okay. The second type of dysfunction is the taut pelvic floor or the taut hammock. Oops, I'm sorry. Okay. So this can be caused by things like stress or by society pressures for body images. Symptoms of a taut pelvic floor are related to difficulty in opening or releasing the pelvic floor, and they can include pelvic or back pain, pelvic floor pain, needing to pee more frequently or pee urgently, difficulty emptying the bladder or bowels, and pain with sex. So remember Brandy, she had a tight pelvic floor or a taut pelvic floor. That was causing her pain, her bladder problems, and pain with sex. Brandy's muscles were so tight that they couldn't relax enough to allow sex to be pleasurable, and instead it hurt. So there were a few reasons that Brandy's pelvic floor tightened up. Going back to the theme of the night with stress, hers was ongoing stress from her study and then worry about her relationship. Because of the increased activity in the sympathetic nervous system with stress that Emma has already talked about, Brandy's pelvic floor muscles were always on. They were never turned off, and they caused a type of protective guarding and tightness. So when I examined Brandy's pelvic floor muscles, they were tight and painful. She had trigger points in them, and she had trouble releasing them and letting them go. Brandy also breathed in her upper chest, which is quite common with stress, but it means that the diaphragm doesn't move up and down like it regularly should with the breath. In the abdominal canister, the pelvic floor mirrors the movement of the diaphragm, so when the diaphragm isn't moving well, then the pelvic floor stays in a relatively shortened position the whole time, which just feeds back into her pattern of protective guarding. So if stress and emotions such as worry, fear, and anxiety continue, the effect is constant overworking and tension in the pelvic floor muscles. So Brandy was also a tummy gripper. She was a chubby child, and she'd been told by her mum to suck her belly in all the time. And so she continued to do that as an adult. Not only that, but remember she dealt with her stress by doing intense workouts, and that included a lot of crunches and planks where she was really overworking her abdominal muscles. So the team of muscles that we've talked about in the abdominal canister are usually constantly moving and working together in response to the breath and movement. Brandy's abdominals were in overdrive, which caused a constant pressure on the front part of her abdomen. So if you think of the abdominal canister like a balloon, and if you squeeze hard on the front of the balloon, the pressure's got to go somewhere, and it goes up and down. So with Brandy, the pressure went up, and that caused her diaphragm not to be able to descend, and so she started having more breathing problems. Okay? And then also the pressure went down, and Brandy's pelvic floor responded to that by creating a tension and trying to rebound and pull back up again, which again fed into the vicious cycle of that chronic tightness and overworking of her pelvic floor muscles. So how did the tight pelvic floor and abdominals actually cause Brandy's symptoms that she came in to see me with? Okay. So overworked and tight muscles can develop trigger points. So trigger points are tender points in the muscle. If you feel around on your neck muscles and you find a really tender point, that's a trigger point. Okay. Trigger points can be painful right where they are located in the muscle, but they can also refer pain to other areas. And the pelvic floor muscles commonly refer pain to the coccyx area or the tailbone area in the back. So that was what was creating Brandy's tailbone pain. Okay. Tight muscles can also create compression or traction on nerves, blood vessels, and lymphatic vessels. They can affect the shape and structure of the pelvic organs, like the bladder and the bowel and the uterus, and that can affect the functioning of those organs. And the pelvic floor muscles and nerves can become so contracted that basic functions such as peeing and pooping, sitting and sex can become very difficult and painful like they did for Brandy. So I'm going to share 3 small changes that have helped Brandy and that everyone can do in today's busy society to make a big impact on their pelvic health. So these 3 things all involve taking the time to stop and listen to your body and can be practiced together as an exercise or on their own. So the first is posture. So be aware of how you're sitting. Make an effort to be tall. Same thing with standing. By stacking the rib cage over the pelvis, you're putting the diaphragm and the pelvic floor in a position they can function effectively together, and you're also improving the bony support of the front of the pelvic bone if you're sitting in the right way. Okay? So the second is breathing. So pop one hand on your upper chest and one hand on your abdominal area. Good. Take a nice deep breath in and feel what you should feel is your lower hand rising and falling with really little movement of your upper chest. So breathing in and feel your abdominals opening, and then breathing out and feeling them relaxed. If you feel that you're doing a lot of work up here, then it's probably good to do some breathing retraining work as well. Okay? And then the third is awareness of the abdominals and the pelvic floor. So by focusing on your posture and your breathing, you've already put the pelvic floor and the diaphragm in good positions to work well. Now bring the awareness to the abdominals again. As you breathe in, feel them open, and as you breathe out, feel them relax. Okay. Now bring your awareness to your pelvic floor. As you breathe in, see if you can feel those sit bones spread apart and open. And as you breathe out, feel them just recoil back in. Okay. So breathing in, feel the opening and a gentle dropping of the pelvic floor, and breathe out and feel it just relax back in. So doing this practice a few times throughout your day will give your abdominals and your pelvic floor a break from the constant go of our lives. And then even better, if you can actually give yourself permission to take some time out, stop, breathe and release. Take yourself away to a place where you have no distractions, no kids, no work, no phones, and focus on your breathing and awareness of your abdominals and your pelvic floor for about 10 minutes a day. So this is just a small piece of addressing the pelvic floor if a patient were to come in with either a taut hammock or a droopy hammock. We also need to treat the physical changes that in the tissues that have developed and functionally strengthen and retrain the pelvic floor muscles along with the abdominal canister muscles. So the most important piece is getting the diagnosis right, because as you've seen tonight, not everyone should be doing pelvic floor and core strengthening. And that's where pelvic floor physios like myself can help you. Thank you.